I'd like to welcome our first guest on the program today. I'd like to welcome Kami Haynes, Director of Marketing with Tango Health, to the program. Kami, good morning. Kami, good morning.
Good morning. Thanks for having me on.
Yeah, good to have you here, Kami. For the audience that may not know Tango Health, give a little background on Tango, if you would, please.
Absolutely. So we've been providing services since 2009. We're headquarters out of Austin, Texas, and we started out providing HSAs for clients who needed those. We've expanded to offer a number of different services, including assistance with benefits administration. But really the thing that we're focused on in the past year or so has been Affordable Care Act compliance for folks who've been dealing with that. It's been an explosive issue this year, especially, we found. So we're helping a lot of clients with that. That's just the majority of the services we provide right now.
Okay, that's great. Well, great. Again, great to have you on the program. I know one of the big sweet spot where you're helping your employer clients is with the very tough challenge of keeping in compliance and really understanding IRS reporting. So what are some of the basic things employers need to know about Affordable Care Act compliance?
So first off, I think we all know that the goal of the Affordable Care Act is really to make sure that everybody had access to affordable health care. So for our conversation, I'm really going to talk mainly about the issues that are facing employer HR teams, because that's our client base. And I'll give you guys some case study for some of our current clients. To start off, just review the basics of how Affordable Care Act compliance is affecting employers, and I'm sure a lot of people are very familiar with this, but I'll just hit on the high points. 2015 is the first year that companies with over 50 full-time employees need to report information regarding employee health benefits to the IRS. These employers with 50-plus full-time employees are considered applicable large employers, or ALEs. And they also have to provide forms to their employees that document the offering of health care benefits. So to do that, these employers have to determine who on their staff is considered full-time. And there are some differing options for that. Some, like, for example, universities consider anybody working 20 hours or more full-time. But for the most part, that's 30 hours or more. But it's not as simple as going, did that person work 30 hours last week? It's really best to use a look-back period to assess the employee's hours over a period of time. And we recommend that employers use at least a 3-month look-back period. But the longer the look-back period, the more accurate the information that they're going to be using to determine eligibility. So aside from determining which of those employees are eligible for benefits, the employer also has to prove to the IRS that their plans are affordable. And the IRS has established a series of safe harbors that employers can use to do that. The main ACA problem that these organizations are facing is that the data that HR teams really need to assess eligibility and affordability for reporting is spread across a number of different applications. So you're talking about HRIS systems, benefits administration platforms, payroll processing applications. Getting the data out of these systems is really proving to be complicated for HR teams, and it's often beyond the capabilities of their IT teams as well. At large employers, the HR team is usually really small. So we've got one client that's got 65,000 employees, and they have 4 full-time HR people. Access to their time and even IT resources can be really limited. Oftentimes, for, say, a school system, their IT resource is just the guy who helps them install laptops. So they're kind of on their own, and they're really struggling with the information they need to determine eligibility for health benefits. So Tango, sorry, go ahead.
No, I think I was going to ask where you're going. I mean, how is it that you go about helping these companies? Well, what is specifically the intervention?
Perfect segue, yeah. So we provide a range of services that help them access that information that they need out of those applications. So we have an integration team that comes in and helps the employers get the data out of those applications. And this is really one of the hardest parts of the whole thing. Integrating with those different systems is something that we specialize in. We are agnostic. We integrate with every single version of that software. And we also have a dashboard that's online, so HR staff can just log into that dashboard once they're integrated and see who's trending eligible and how the affordability is working out. And it's really easy for them then to set up, this is the packets we need to get out this month, or here's who we need to be offering benefits to, or even here's where we need to be turning off benefits for people who have left the company. So we have a comprehensive service that helps them through all of that, and it works throughout the year. It's not just an onboarding and then we leave you alone. we really have a full service offering that makes sure they're tracking everything needed for compliance.
That's good stuff. What's coming in 2000? Next year, Kami.
2016.
Yeah, 2016 that employers need to be concerned about. I mean, we know what's coming in 2018 that everyone's concerned about, but what's coming in 2016? Anything new that they've got to be aware of?
Well, I think that the real thing that folks need to be considering, and the hot spot for folks right now, aside from this is kind of open enrollment time, everybody's really scrambling to get the data they need to do the 1095-C reporting. And, your listeners probably know that's the form that goes out to the employees. And that form is kind of complicated. There's a lot of stuff on. It's a lot more complicated than just a W-2, which everybody's familiar with. So getting that put together and out the door to employees is turning out to be a real hassle for folks. And then what we're also seeing, in March you're going to have to report to the IRS, and that's turning out to be a seriously complicated situation. So just to give you guys an example, right now we're working really closely with the IRS to do test uploads to their system, and we're having problems consistently that we're going back and reporting to them. You've given us information that's now not working with your system. And the IRS keeps coming back to us and going, we'll get back to you on that. So the process of getting all this stuff out, getting it uploaded to the IRS is really going to it's going to consume that first quarter of 2016 for people. And then everybody's going to take a big collective breath, and they're going to look at the rest of the year and they're going to go, man, that was hard. How do we do it better for the next round?
Is this the kind of thing that, accounting firms are getting involved with?
There are some accounting firms
outside of their scope.
Yeah, it is, and it's new for everybody. It just so happens that we've had clients who were preemptive, who didn't expect it. They thought they better be ready in case it didn't go away, which it didn't, and they asked us to get ahead of the curve on this and really help them create solutions. So that's how we were able to have a product rolled out to the market. And we're also hearing that a lot of our competitors have either stopped taking business or are waitlisting clients. And so, we're still taking business from folks, and we recognize that at this point in the year, probably some people are going to be late. But we're doing everything in our power to help them show that good faith effort that they're getting a response out.
Gotcha. What happens if if an organization doesn't comply? I mean, what are the repercussions or consequences?
Yeah, it's a big deal. So we're actually looking at prices. There's going to be fines. IRS is going to assess fines for things like failing to report and fines for inaccurate reporting. So you're kind of damned if you do, damned if you don't. If you throw something out there and hope it's going to stick, you're going to get fined. If you don't send anything because you're paralyzed with fear, you're going to get fined. So then you also have that problem where if a benefit feels like or if an employee feels like the benefits you're offering aren't affordable and they go to the exchange, you're going to get fined. And the way the IRS is handling that is it's not that you get to talk to them about it. They're going to assess you with a fine, and you are guilty until you prove yourself innocent. So there's also, the possibility that you're going to get sued by an employee. So all of that stuff is out there, and it's not just the fines from the IRS or the possibility of lawsuit. As a marketing person, I'm always thinking about the damage to the company's brand. So you may have heard that there was a company earlier in this year who decided they were just going to cut everybody's hours so that they didn't meet that requirement of full-time. And that company got a lot of bad press. So nobody really wants to take those kinds of hits. You don't want to be the person who's first in the news for getting audited or fined by the IRS for this stuff.
So Kami, for the recommendation for organizations struggling with this right now is I'm going to assume is they should knock on Tango Health's door.
Yeah. Well, first and foremost, they just really need to get help. If you're trying to tackle this yourself, and our sweet spot is really larger companies, so it's people who have 1,000 employees or more. For the smaller companies, yes, it's definitely a hassle for those guys, but we bring a level of service to bear that those larger companies that are more complex can really take advantage of. So, what do I mean by complex? We're talking about employers who have a lot of variable hour employees, or unions, which are a specific problem, multiple EINs. We have a lot of clients that have 17 or more EINs. So they have to decide if they're going to report individually or if the parent organization is going to handle the reporting, and they got to get their ducks all in a row on that. Also, companies or organizations that have experienced acquisitions or mergers or spin-offs or layoffs. And, think about the oil and gas industry with their quick ramp up and then ramp back down. Or even seasonal workers. So I could go on, but those organizations have a lot of complexities, and that's really Tango's sweet spot, is helping those complex organizations solve this problem. And we bring a level of service and customization to the Affordable Care Act compliance that our competitors really don't have.
Kami, what is the, across your client base, what is the biggest concern from your employers regarding the Cadillac tax?
That's a great question. I think a lot of people are just hoping it's going to get struck down and it's going to go away. But, that's what's going to fund a lot of these subsidies that are going out. So we're already paying this money out. I think the Cadillac tax in some form or fashion is just going to stick around, and people really need to face it. We had one client that came to us early on in last year and was worried about their exposure. And the way we're working with them, it takes into consideration some of our other products and service offerings. So we went out to their site, and we're doing it again this year. We've got, I think, 36 different site visits over the course of their open enrollment period, and we're helping to educate their employees about high-deductible plans, because these guys have a real competitive workspace. They don't want their employees to feel forced into a plan because they might lose those. So what is happening is we're helping educate those employees about where they save money. And we've got a decision support tool, sort of a calculator, that actually uses that company's benefits costs. So each individual can put in what they think their family is going to need over the course of a year and see how much they save. So when you show an employee how they save money, they're not necessarily doing this for the greater good of the company. They're doing it for their greater good. So we saw last year with that client, they had a large number of people move into those high-deductible plans, which brought their Cadillac tax exposure for 2018 down by $8 million in 1 year. So that's a significant savings, and it's even provided savings for them around the health benefits they're spending per year, which is also a huge number, second only to payroll. And it dropped pennies to their earnings per share. And there's CFOs out there, if you say, hey, I'm going to add 10 cents to your earnings per share, they sit up and take notice. So that's really something we're helping people get ahead of with the Cadillac tax that offers additional benefits.
Yeah, that's interesting. Your go-to-market strategy, Kami, I'm assuming you go direct to these mid-size to larger companies, but do you have distribution partners, too, that you work with?
We are a preferred vendor with a lot of the consultants out there. So Mercer and Towers Watson and Aon all have us on their preferred vendor list, and we take a lot of meetings with them to support them. And they, since they're their client's trusted advisor, they like to have a vendor they can bring to the table that's successfully accomplishing this. And we've got clients across every single industry, so it's really easy for us to show how we're already helping somebody who looks like you solve this problem.
Do you see the opportunity, or are you in discussions, or have you looked at it, the integration of your solution with the emerging private exchanges in the market?
I don't know about the private exchanges so much as these companies that are providing, conscious consumerism. I've heard a couple of stories recently about companies that are, aside from the ones that are established in the industry, who are helping people make better choices about healthcare. And it's so funny to me that if I'm going to spend money on a car, I do a lot of research. But if I got to go get an MRI, I just go wherever my doctor told me. I think that understanding the costs associated with that, and I am on a high deductible plan, so it's important to me to know how much I'm going to be out of pocket. So I want to know those things. I think for us, understanding that part of it is a lot more important. Plus, being able to give people direct information about, so for example, our decision support tool for this particular client, they've given us access to their employees' past histories, and it's all anonymized, but that specific employee can look and see what they spent last year. And it's a lot easier. I can't remember off the top of my head when I went to the doctor or how much I spent, but if it's in that calculator and I can take a look at what I did last year and make a choice for next year, it's a lot easier. So we provide all those services, and I think more partnership around that is just going to make us stronger.
That's interesting. Well, I love what you guys are doing. You've done some really good stuff. I think there's a big need here to help, not only employees and employers kind of help make the right decisions, but certainly the compliance issue that's a big sweet spot for you. I mean, it's it's a tremendous challenge for employers out there, as kind of you have highlighted on this program. Kami, I've enjoyed having you on the program, and we appreciate your time. I want to give you an opportunity to leave our audience with some takeaways and also tell them how they can get in contact with you guys.
Sure. So I would say that, if you're a company of 1,000 employees or more, or a company that's got a lot of those complex situations, give Tango a call. If you haven't started compliance, by all means, let's get busy. If you have and you're not quite sure that things are going the way you want them to, you can also give us a call. And you can reach us at www.tangohealth.com.